Hi, my name is Erica LeGrand, and today we're going to be talking about eukaryotes and viruses, but specifically we're going to be talking about influenza today. The scientific and classification of influenza depends on its type. It's type A or type B. The domain for influenza type A and B is virus, and the family is Orthomyxoviridae. The genus is alpha influenza virus and beta influenza virus, and the alpha is influenza A and the beta is influenza B. The species is the same, influenza A, influenza B, and this classification structure highlights the unique and genetic phenotype traits of each virus type. Influenza's life cycle and natural hosts. Influenza viruses enter the respiratory tract, bind to host cells, and release their RNA inside. This RNA replicates, creating new viruses that spread to other cells. Influenza A infects humans and animals, while influenza B mainly affects humans and can also sometimes affect seals. The structure and characteristics of influenza. Influenza viruses are spherical or filamentous, enclosed by a lipid envelope from the host cell membrane. Two surface protein HA and NA aid in viral entry and exit. They are RNA viruses carrying genetic material. They are RNA viruses creating genetic material as ribonucleic acid, which is RNA. Diseases caused by influenza. The overview. Influenza virus are a major cause of respiratory illnesses in humans, with symptoms ranging from mild to severe. Common symptoms are fever, cough, sore throat, aches, and fatigue. Complications and risk groups. Severe complications like pneumonia, particularly in high-risk groups such as young children, elderly, pregnant women, and individuals with chronic health conditions. The transmission of influenza. The primary transmission is it spreads through respiratory droplets that are released when an infected person sneezes, coughs, or speaks. Transmission to droplets. When these droplets are inhaled by nearby, they can carry the virus, the respiratory tract, leading to infection. Transmission 3 is surface contamination. The virus can also be transmitted through contact with contaminated surfaces such as doorknobs, countertops, where the droplets have settled. And then indirect transmission is after touching these contaminated surfaces, the viruses can enter the body and individual touches their mouth, nose, or eyes. Cause of disease and symptoms. General symptoms include fever, chills, cough, sore throat, runny nose, muscle aches, and fatigue. Symptoms usually appear 1 to 4 days before exposure and last about a week. Potential complications are severe cases can lead to pneumonia, heart inflammation, brain swelling, muscle inflammation, or even multi-organ failure. And high-risk individuals are elderly with chronic health issues, may experience more severe symptoms and complications. Treatment of influenza. Effective treatments are antiviral medications are the most effective for influenza. Timing and benefits of treatment. These medications are most beneficial when taken 48 hours of the first symptoms, helping to lessen the severity and shorten the duration of the illness. And antibiotic use. Since influenza is a viral infection, antibiotics are not effective and should not be used for treatment. The prevention of influenza. The best way to prevent the flu is through yearly vaccination, regular hand washing, avoiding close contact with the sick. Wearing masks in high-risk areas can also lower the risk of infection during flu season. And fun fact about influenza, each year around 8% of Americans are affected by the flu. The number can range from 3% to 11%, depending on the severity of the season. Notably, children under 18 have more than double the likelihood of catching the flu compared to older adults over the age of 65. And here are my references. Thank you.